Our patient is a 55-year-old male who comes in with a diagnosis of left knee osteoarthritis. He has limited range of motion and strength, and his compliance to his home exercise program is questionable, and he continuously asked if aquatic therapy would be a better solution for him, as he had previously tried it in the past. This patient lives independently and wants to be able to ambulate for activities of daily living in the community. We were interested to see if there's a difference between treatment on land or in the pool with regard to affecting the level of pain, strength, and disability in these patients. Based upon our patient, we came with the clinical question of, in adults with lower extremity osteoarthritis, is aquatic therapy more effective than land therapy in improving quality of life and overall patient outcomes? The purpose of this critical appraisal was to determine the quality of the articles and whether or not strategies mentioned are safe, effective, and reliable. We decided to utilize 3 databases in retrieving our review articles: NCBI, Google Scholar, and Pedro. Our search strategy initially started with 47 articles, with the main search terms including aquatic exercise, land-based exercise, and osteoarthritis. We did further in-depth research utilizing certain inclusion and exclusion criteria to narrow our searches, to allow us to attain better quality articles for our topic. In order to reduce the number of hits to articles most relevant to us, we limited the search to those who were published within the last 5 years. We selected 8 articles that we found were constructive for our clinical question. We reviewed each type of study design according to their specific level of evidence. We had 3 randomized control trials, 4 systematic reviews, and 1 quasi-experimental. We predetermined high-quality articles to include a large sample size, results consistent with those found in other studies, and sufficient evidence and statistical data to prove their result. Good quality articles should have a medium to large sample size, results mostly consistent with other studies of the same topic, and have decent statistical data to show results. Low quality studies would have an insufficient sample size, results which are not consistent with other studies, and lacking interpretable evidence or results. We used the appraisal tools, CASP for systematic reviews, Pedro for randomized control trials, and the Johns Hopkins Evidence-Based Practice Research Evidence Appraisal Tool for all other research study designs. After analyzing each of the articles, we summarized that aquatic therapy programs seem to hold no significant superiority over land-based exercise programs, other than a decreased perceived pain rating, which was found in a couple of studies. This means that when viable, giving a patient the choice between land therapy and aquatic therapy, this may be appealing to the patient. In turn, this preference for the patient may play a key role in improving patient outcomes and participation, which can determine a successful intervention. Some limitations that we had were having a small sample size, which resulted in a decrease of the external validity of the studies. One particular study used convenience sampling in a local town, which resulted in a small sample size. Using a different form of sampling or choosing a larger area for the selection could have allowed the study a more efficient sample size. Another limitation found was that the majority of the studies had no long-term follow-up of its participants. Without a long-term follow-up, the lasting effects of aquatic-based exercise for patients with lower extremity osteoarthritis are unknown. Each study had a different list of inclusion and exclusion criteria, as well as different modes and parameters of exercise affecting the internal validity of the studies. Future studies could use a standardized exercise parameter to decrease variability. Finally, having a lack of up-to-date articles about this topic questions the external validity of the use of exercise in aquatic-based therapy in light of modern technology. In our presented case study, there are no apparent comorbidities or contraindications that would prevent us from implementing some of aquatic therapy into the patient's regimen, especially since he has tried aquatic therapy before and expressed his interest. His motivation would be beneficial for this treatment, and adherence would be a lot better than before, which will only have a positive effect on his prognosis. Pain is indicated in this case to be the patient's primary symptom, and the studies have shown that there has been positive results for this specific outcome. Furthermore, regarding the generalizability of the case study, the research population criteria range from individuals aged 35 and up, as well as did not differentiate between men and women that were all diagnosed with the same form of osteoarthritis. So these results can be generalized to this case study with the 55-year-old male. The benefits of this treatment include a safer alternative to land-based exercise and a higher level of treatment adherence in this patient specifically, as well as the buoyancy of water, reducing weight-bearing stresses of the joints, the bones, and the muscles, which is desirable in this diagnostic population. It concluded that in this controlled setting, the risk of injury does not outweigh the potential benefits that can be produced to improve patient outcomes with aquatic therapy.